Welcome back to the Deep Dive. Today we are diving deep into a health topic that, well, many pet owners might unfortunately encounter. Cutaneous squamous cell carcinoma in dogs and cats.
That's right. We've gathered quite a stack of articles and research papers here. And our mission in this deep dive is really to cut through the jargon, give you the essential knowledge.
What it actually is, maybe some surprising reasons why it pops up.
Yeah, and how you, as a pet owner, might spot it early. What happens if your vet does find it? And maybe most importantly, what you can do to help your furry friend avoid it altogether.
Think of this as your shortcut, kind of to understanding this specific issue. We're pulling the key insights straight from the source material for you. Let's unpack this.
Okay, so let's start with the basics. Cutaneous squamous cell carcinoma, or SCC for short, it's a type of malignant tumor, meaning cancerous, that grows in the skin. It actually starts from the most common cells right there on the skin surface, the keratinocytes.
Right. And the sources are really specific here, aren't they? We're talking cutaneous SCC,
Yeah.
so just the skin, which is different from SCC that might show up, say, inside the mouth or maybe on the toes. Those can behave a bit differently, I gather.
Exactly. This deep dive is focused specifically on the skin form. And, it's more common than a lot of people might realize.
Really?
Yeah, across all the sources, it's consistently noted as one of the most frequent skin cancers vets see in both dogs and cats. We're talking making up a pretty significant percentage of all diagnosed skin tumors. The numbers vary a bit source to source, but definitely common.
And it tends to affect older pets, right?
Yeah.
I saw typical age ranges mentioned.
Yes, generally diagnosed in our older companions, sort of middle-aged to senior pets.
Okay, so that brings us to the big question. Why does this happen? What causes it?
Well, if there's one thing the sources absolutely agree on, it's the huge role of ultraviolet radiation, UV light, basically sunshine.
So sun exposure is really the #1 driver here.
Absolutely. The research points squarely at UV light, especially the UVB rays, as the primary culprit. And it makes perfect sense, really, when you look at where these tumors tend to appear.
Right, you mean on the spots with less fur or lighter skin?
Precisely. Areas of skin that get a lot of sun but don't have much hair or pigment for protection.
Yeah.
Think about the tips of ears, especially on cats, the nose, eyelids, lips.
Even the belly or scrotum on dogs, maybe. They like to sunbathe upside down.
Exactly.
Yeah.
Those areas that get direct sun and just have less natural defense. Less pigment means less melanin, which is kind of nature's sunscreen. It's why you see a higher risk in light-colored pets. It's interesting, one source even mentioned a specific place, Norco, California,
Oh, yeah.
as an area where vets see this a lot, likely because of all the sunshine. Really highlights that environmental link.
That makes a lot of sense. So sun is the big one. Are there other factors involved? Did the sources mention anything else?
They do list a few others, but UV is definitely the star of the show, so to speak. There's some mention of chronic inflammation or trauma, like old burn scars maybe, but that seems to be a pretty rare cause.
Okay, so ongoing irritation could potentially be a trigger, but it's not the main story.
Right. Then there's papillomavirus. That's implicated in some forms, particularly a less common type called multicentric SCC. Studies are actually showing an association with this virus in a notable percentage of feline cases, and it's also been found in dogs.
So viruses might play a role, especially for that specific kind. What about genetics? Does breed make a difference?
Yes, breed predisposition is definitely noted. Suggests there's a genetic component. In dogs, certain breeds seem more prone. The list included Scottish Terriers, Pekingese, Boxers, Poodles, several others. For cats, it seems more tied to just having that lack of pigment or thin hair, though breed can influence that, of course.
And I think I saw mentions of things like environmental chemicals, secondhand smoke, but maybe less certain.
Correct. Those factors are less clearly established compared to the UV exposure link. And for that multicentric form in cats, the Bowen's-like disease, the risk factors aren't as well understood. Maybe some link to a suppressed immune system, the sources suggest.
Okay, so UV radiation, especially hitting that unprotected skin, that's the key risk we need to remember. Now, from an owner's point of view, what would you actually look for? What do these things look like?
Yeah, this is where being observant really pays off because they can start out looking pretty harmless, very subtle. Often, they first appear just as little non-healing sores or scabs, and usually in those vulnerable sun-exposed areas we talked about.
Like the ear tips, nose, eyelids on cats.
Exactly. And for dogs, maybe the underside, the belly, groin, scrotum, or the nose, sometimes ears too.
So if you've got, say, a white cat who keeps getting a crusty spot on its ear that just never quite heals up, that should ring some alarm bells.
Absolutely. Don't ignore a persistent sore. That's the key message. The sources describe the appearance as quite variable, actually. Early signs, sometimes called actinic keratosis, which is sort of precancerous.
Like sun damage turning bad?
Pretty much. That might just look like a reddened, scaly patch, maybe some hair loss around it, just sun-damaged skin starting to change. As it progresses, it can become ulcerated, so looking red, raw, maybe inflamed. Sometimes it bleeds easily. You
Right.
might see scabs that form, fall off, then form again. Or it could become more proliferative, growing outwards, sometimes described as looking a bit like a tiny cauliflower. Or just the thickened plaque-like area.
And are they uncomfortable for the pet? Do they itch or hurt?
They definitely can cause discomfort, pain or itching, which might lead the pet to lick or chew at the area, and sometimes that just makes it look worse, more irritated.
Right. And you mentioned that other form too, the multicentric one.
Yes, the multicentric SCC, sometimes called Bowen's disease or Bowenoid carcinoma, that looks a bit different. It's less common. You see multiple, often superficial lesions. They aren't necessarily tied to sun exposure and can pop up anywhere: head, neck, chest, belly, even toes. They might even look pigmented, sort of dark initially before they get crusty or ulcerated, and the hair might fall out easily around them.
Okay, so quite a range of appearances. If you see something suspicious, how does the vet figure out for sure if it is SCC?
Well, the sources are unanimous on this. You cannot diagnose SCC just by looking. Absolutely cannot. A definitive diagnosis requires getting a tissue sample and sending it off to a lab. A pathologist looks at it under a microscope. That's called histopathology.
Okay, so a biopsy is absolutely essential. What are the steps leading up to that? What does the vet usually do?
It typically starts with a really thorough physical exam. The vet will look closely at the lesion, feel it, check its size and texture. They'll also carefully palpate or feel the nearby lymph nodes to check if they feel enlarged. Though, as we'll discuss, spread to lymph nodes isn't super common for typical skin SCC.
Okay.
They might try what's called a fine needle aspirate, or FNA. That's using a small needle to suck up some cells. But the sources warn that FNAs are often inconclusive for SCC. Especially if the lesion is ulcerated or inflamed, you might just get inflammation cells. It can't definitively rule out SCC if it's negative.
So if the vet really suspects SCC based on the look and location, they need to push for a biopsy.
Yes, exactly. The biopsy is the gold standard. It's crucial. This involves surgically removing tissue, either a small piece from a larger lesion, an incisional biopsy, or, if the lesion is small enough, removing the whole thing right then and there, an excisional biopsy, which can actually be curative sometimes. Getting that tissue isn't just for the yes or no diagnosis. The pathologist also grades the tumor based on how abnormal the cells look. That gives important information about how aggressive it might be and helps guide the treatment plan.
And do they usually check if it's spread anywhere else, like x-rays or anything?
Good question. For the typical cutaneous form of SCC, metastasis, that means spread to distant organs like the lungs, is relatively uncommon. It's more of a local problem. However, for tumors that are very large or look particularly invasive, or maybe based on the histologic grade, the vet might recommend staging tests. That could include chest x-rays, usually 3 views to check the lungs, or sampling those regional lymph nodes, maybe even with a biopsy, even if they don't feel obviously enlarged. Maybe abdominal ultrasound if the lesion is on the back half of the body. It helps get the full picture, though again, widespread spread from standard skin, SCC isn't the usual scenario.
Okay, good to know that spread isn't the main worry for this skin type. But since these lesions can look like so many different things, what else might a vet be thinking it could be before the biopsy results come back?
Right, and that's exactly why the biopsy is so critical. SCC can really mimic a wide range of other issues. The sources list things like chronic bacterial infections, like deep pyoderma or abscesses, other types of tumors, both benign, like papillomas, or other malignant ones, like melanoma or mast cell tumors. Even some autoimmune skin diseases can look similar, or just plain old trauma or burns that aren't healing properly. It really underscores why you can't just guess based on appearance.
Makes total sense. You need that lab confirmation. So let's say the biopsy confirms it is cutaneous SCC. What are the main treatment options then?
The absolute key takeaway here, the main goal, is aggressive local control. Because this tumor is known for being invasive right where it starts, but usually doesn't spread far and wide, the focus is all about dealing with that primary site completely and effectively.
And what's generally the best way to achieve that local control?
Surgery. Surgery is consistently highlighted across the sources as the treatment of choice, the gold standard, really. The goal is complete surgical excision with wide, clean margins.
What does wide, clean margins mean exactly?
Right. It means the surgeon removes not just the visible tumor, but also a border of apparently healthy tissue all around it and underneath it. Typically, they aim for about 1 to 2 centimeters on the sides and go down deep enough to remove it along a natural tissue plane, like the fascia above muscle. This is to try and ensure that any microscopic fingers of cancer cells extending out are removed too.
So really getting it all out, plus a safety buffer.
Exactly. And for lesions in those tricky spots, like ear tips or the nose leather, specific surgeries like penectomy removing part, or all of the ear flap or nasal planectomy removing the affected part of the nose surface are often done. And the sources say these can be very successful, often curative, because you can get those wide margins.
Okay. Are there other options besides major surgery? Maybe for smaller spots.
Yes, for very small or superficial lesions, other local methods might be considered. Things like cryosurgery, which is freezing the tissue, or electrosurgery using electrical current, or CO2 laser ablation. These can sometimes be options, particularly if surgery is difficult for some reason.
What about radiation therapy? Where does that fit in?
Radiation is another really important tool in the toolbox for SCC. It can be used in a few ways. As an adjuvant therapy, meaning after surgery if the surgeon wasn't completely sure they got clean margins, or as the primary treatment if surgery just isn't feasible because of where the tumor is or how big it is. It can also be used palliatively just to shrink the tumor, reduce pain, and improve quality of life, even if a cure isn't likely. There's also a specific type, strontium-90 brachytherapy, mentioned as very effective for small, superficial lesions in cats, like on eyelids or the nose.
Okay. And what about chemotherapy? The drugs people often associate with cancer treatment.
Right, this is a really important distinction the sources make. For typical localized cutaneous SCC, the kind we're mostly talking about on the skin, systemic chemotherapy, meaning drugs given by mouth or injection that travel through the whole body, is generally not recommended as the primary treatment.
Why not? If it's cancer?
Well, mostly because, as we said, the rate of metastasis or spread is pretty low for this specific type of skin cancer. And unfortunately, these particular skin tumor cells often don't respond that well to the standard chemotherapy drugs when they're just confined to the skin. So the potential side effects of chemo often outweigh the limited benefits unless there's confirmed spread to lymph nodes or lungs, or if the tumor is behaving in a very unusually aggressive way.
Okay, so the focus is really on getting it out locally, not necessarily on treating the whole body systemically unless it's already spread.
Precisely. Now, there are some approaches where chemotherapy drugs might be injected directly into the tumor. That's called intralesional chemotherapy, or used alongside electrical pulses called electrochemotherapy. Those are local treatments. But body-wide chemo usually isn't the first step for standard cutaneous SCC.
Got it. And what about topical treatments like creams you'd put on the skin? Are there options there?
This is another area where the sources give some important warnings. Some creams used for human skin cancers or precancers, like 5-fluorouracil, 5-FU, are highly toxic to pets, especially cats if they lick them. So absolutely crucial not to use human products unless your vet specifically prescribes something.
Okay, that's a really critical warning.
Definitely. There is one topical cream called imiquimod that does show some promise, according to the sources, especially for those superficial multicentric lesions in cats, but it can cause significant local irritation, redness, and crusting. And often, even if it clears the initial spots, new ones can pop up later, so it might require ongoing long-term treatment. Not always an easy fix.
Right, sounds like managing expectations is key there. What about just simple things like managing pain or inflammation?
Yeah, absolutely. NSAIDs, non-steroidal anti-inflammatory drugs like piroxicam or meloxicam are often used. Sometimes they're used partly because there's some evidence they might have a small anti-tumor effect on SCC themselves, but mainly they're important for managing pain and inflammation associated with the tumor or the treatment, improving the pet's comfort and quality of life. They can be used alongside other treatments or sometimes just for palliative care.
Okay, so main tools. Aggressive surgery first, if possible, maybe radiation, other local methods for some cases, and supportive care like pain relief. What's the general outlook? What's the prognosis after treatment?
Generally speaking, the prognosis is actually very good to excellent, especially if the tumor is caught early, is superficial, and can be completely removed with clean surgical margins.
That's really encouraging news for owners facing this.
It really is. The factors that tend to worsen the prognosis are things like incomplete surgical removal if some tumor cells were left behind, or if the tumor gets a high grade on the biopsy report, meaning the cells look very aggressive. And of course, in those rare cases where it has metastasized or spread. But for those common sun-induced SCCs on cats' ears or noses, for example, the sources state that surgery or sometimes radiation offers very good local control and long-term outcomes.
And what about that multicentric form you mentioned in cats? Is the outlook the same there?
For the multicentric form, the prognosis is usually considered more guarded, not necessarily because any one lesion is immediately life-threatening, but because new lesions tend to keep popping up over time. One source mentioned recurrence or new lesions in up to 75% of cats, so it often becomes more about ongoing management rather than a one-time cure. And it's worth noting, prognosis can also vary a bit depending on the exact location. SCC on the toes, for instance, or deep on the nose, or inside the mouth cavity, those sometimes behave more aggressively and might have a less favorable outlook than a simple SCC on the skin of the belly.
Okay, that makes sense. So after treatment, how do owners and vets keep an eye on things? What does follow-up look like?
Monitoring is definitely key. Right after surgery or treatment, the vet will check the site for proper healing. Then, regular recheck exams are really important. The sources generally suggest maybe every 3 to 6 months, especially for the first year or two. During these checks, the vet will do a thorough physical exam, carefully feel the original tumor site for any signs of regrowth, and palpate those regional lymph nodes again.
And owners need to be doing checks at home too, I assume.
Absolutely. Owners are truly the first line of defense. Regularly examining your pet's skin, especially if they are high-risk light fur, loves the sun. Just feeling for any new bumps, scabs that don't heal, sores, thickened areas, particularly in those high-risk spots we keep mentioning: ears, nose, belly. If you see anything suspicious or different, get it checked by your vet promptly. Don't wait and see for too long. For higher risk cases like incompletely removed tumors or high-grade ones, the vet might recommend periodic chest x-rays as well, just to be safe.
Makes sense. Now, given that sun exposure is just such a massive factor here, prevention seems like it should be a big focus. What can owners actually do to prevent this?
Yes, prevention, or at least minimizing risk, is crucial, especially for pets living in sunny places or those with white or light-colored fur and thin hair. The sources strongly emphasize limiting sun exposure, particularly during the peak UV hours. That's generally between about 10 a.m. and 4 p.m.
So maybe shifting walk times or outdoor playtime to earlier in the morning or later in the afternoon.
Exactly. Simple changes like that can make a difference. Providing plenty of shaded areas when pets are outside is also really important. A shady tree, a covered patio, access to come indoors, and then there's sunscreen. Using pet-safe sunscreens on those vulnerable, sparsely haired areas like the nose, ear tips, maybe the belly if they sunbathe.
That's safe being the key word there, right? Not human sunscreen.
Absolutely critical. Pet-safe only. Many human sunscreens contain ingredients like zinc oxide or salicylates that can be toxic if pets lick them off. So look for products specifically formulated for dogs or cats.
Good tip. I think I saw something mentioned about tattooing. Is that a real thing?
It was mentioned in one source, yeah.
Yeah.
The idea of tattooing non-pigmented areas, like maybe the ear tips, to essentially add pigment for sun protection. It's not a common recommendation, I'd say, and probably not practical for many, but it was listed as a potential method. The main focus is definitely on sun avoidance and appropriate sunscreen use.
Okay. So sun protection is really paramount. And just being super observant for any skin changes that stick around?
Yes. Early detection makes such a difference. When these tumors are caught small and superficial, treatment is often much simpler, less invasive, and has a higher success rate. It's really about owners recognizing any non-healing spot or new growth and getting it looked at quickly, and then having that open conversation with the vet about what it is, what the treatment options are, the costs involved, and what the likely outcome is.
Definitely. There's one last point that usually comes up with pet health issues, especially cancers. Can humans catch this from their pets? Is there any risk?
That's always a very understandable concern, and the sources are very clear and reassuring on this point. There is absolutely no evidence of direct transmission of cutaneous SCC from pets to humans. You cannot catch this type of skin cancer from your dog or cat, full stop.
Okay, that's a huge relief for pet owners. But I think I saw something interesting mentioned about similarities in research between human and pet SCC.
Yes, that's a really fascinating area of recent research mentioned in one of the papers. Scientists have found some interesting similarities in the skin microbiome. That's the community of bacteria and other microbes living on the skin. Specifically, certain types of Staphylococcus bacteria seem to be present in both human and pet SCC lesions. This suggests that pets could actually be really valuable models for studying how factors like the microbiome might influence cancer development in general. But, and this is the important part, it absolutely does not mean the disease is contagious or can be passed between pets and people.
Wow, that is interesting. It hints at maybe shared environmental influences or similar biological pathways, but great to have that confirmation. No risk of catching it from your pet.
Exactly. No direct risk there at all.
Okay. So, wrapping up this deep dive then, what are the main things we want people to take away about cutaneous SEC in their pets?
Well, I think the big points are it's a common skin cancer, number one. It's very strongly linked to sun exposure, especially in pets with light skin or fur, and tends to show up in older animals.
Right. And while it's typically a local invader, meaning it doesn't usually spread far, it can be quite destructive right where it starts if not treated.
But, and this is the really good news, if owners are vigilant, if they spot those early signs like non-healing sores, and if vets diagnose it definitively with a biopsy, then aggressive local treatment, most often surgery, usually offers a very good to excellent chance for long-term control or cure.
It definitely highlights how important it is for us to be proactive, observant pet owners, especially if you live somewhere sunny or have one of those pale-skinned sun worshippers.
Precisely. Know your pet's body, know what's normal, and investigate changes.
So here's a final thought, something that really struck me. We've talked a lot about the link between UV exposure and skin damage in our pets. And it's obviously a huge factor for us humans, too. And then you add in that intriguing emerging research about the skin microbiome possibly playing a shared role across species. Makes you wonder, doesn't it? How does thinking about protecting your pet from the sun maybe make you reflect differently on your own sun habits or even the broader environmental factors like maybe the microbes we share in our homes and environment? Just something to mull over.